I'll ask the panel to introduce themselves. Dr. Kuti?
Thank you very much. My name is Femi Kuti, co-founder at Canpay/Reliance HMO. We basically make it easy for people to purchase health insurance from their mobile phones and have access to hospitals from day one.
Hi everyone, my name is Dr. Ola Brown. 10 years ago, I started an air ambulance service which has morphed into the largest air ambulance service in West and Central Africa. And we specialize in the transport of patients from an area where they've overwhelmed the level of care to a more suitable level of care for them. Sometimes that's in the country, sometimes that's within the region, and sometimes that's internationally.
Hi guys, I'm Deepankar from vconnect.com. It's a platform that enables users to find right service professionals. And these service professionals are from various segments, including the healthcare segment, enabling them to find the right diagnostic sectors or the right doctors they need at various points in their life.
Hi, my name is Temi, Giwa-Tuboson, and I'm the blood lady. Life Bank helps hospitals find the essential medical products they need, starting with blood. We're essentially a medical distribution company using technology and logistics to save lives across the country.
Okay, thank you. Now, I've been asked to sit down, so I'm going to try and talk sitting down. Very difficult for me. Now, let me just tell you what the problems are in healthcare, all right, from my perspective, and then we'll ask the panelists to tell us what solutions are out there. One problem, skilled manpower. There's a shortage of skilled manpower, that is highly trained doctors, nurses, technicians. Power. I don't know if you guys have a solution for power, but that is one of our biggest challenges. Training, how to get people trained. It is very expensive sending people abroad to get trained. In the meantime, our educational institutions are not running at full speed yet. Then, telemedicine. A lot of us have started using low-tech telemedicine like WhatsApp. Now you'll be surprised, but WhatsApp has actually improved the quality of healthcare. But there are concerns, medical legal concerns, and I have a question for Dr. Femi about that, because he has his platform where people give medical advice online using the phone. And one of the questions I have is, can you be medical legally held responsible for wrong advice without seeing the patient? And then we have equipment costs, access to healthcare, especially in the remote areas. I believe tech can help us with this. The phones have penetrated all these remote areas, so I'm sure there's technology that can help with this. Then there's healthcare insurance, how to verify claims and things like that. Technology is one of the things that will help us streamline that. Ambulance services, that's one of our weak points in Lagos. Well, compared to the rest of the country, ambulance services exist in Lagos, but you call, I'm sure tech can help us improve those services. Then there's the blood bank part of it. So I'll start with Deep. Is that right?
Perfect.
We have a problem with manpower. How does your platform help us with that?
So our platform does not really play a very big role in terms of helping in the manpower, but what we do is we work with the training institutes in various fields. Like I'll tell you the program that the Lagos State Employment Trust Fund has, or the program that various institutions who are generating skilled resources for various industries are working on. We help them train the institutes and then help them get placed with different businesses, because we have a data bank of businesses who are active in this field. So if we can understand what are the requirements of the training, and we can work with training institutes in terms of the primary training. So medical or the healthcare sector require trainings or skilled workers in various levels, from going up to a doctor or a surgeon, but also you need nurses, you need support structure, you need people who are qualified to reduce the trauma and stuff. So in that case, there is a lot of training that can be done here, and not everyone has to be trained internationally. So we understand what is the requirement and who are the institutes that can work on training them. Then we can actually bridge that gap between the people trained and the institutes or the companies that are looking at creating that.
Thank you. Dr. Ola, I hear you have a passion for primary health care. This is what I'm told. Am I incorrect?
Okay, go on.
Okay. How do you think tech will help us improve primary health care?
So I've always believed that primary healthcare is the cornerstone of any healthcare system. I think it's the most important part of primary healthcare. And I think one of the big problems in Nigeria is actually we're obsessed with hospitals. So we have a very hospital-centric healthcare system. And it's not just the politicians. The politicians love to launch them, but also we love to, go around hospitals and make. There's a lot of social capital around hospitals, but actually the most fundamental part of healthcare has always been, will always be, basic sanitation, water, hypertension management, chronic disease management, and that should happen outside the hospital. And we haven't evolved to the point where we have primary healthcare centers that can do that. Now, what I do comes in when the primary healthcare system has some sort of either time-critical illness or emergency where that can't be handled at the primary healthcare level. And that's when patients get transferred either by road or by air to a tertiary referral system. But I think 90% of the problems in Nigeria do not require a hospital in terms of our healthcare system. It is malaria, it is gonorrhea, it is cough and cold, it is headache, it is back pain. And our hospitals become very congested because they are handling a lot of issues that should have been prevented at the primary healthcare level or managed at the primary healthcare level.
Okay, Dr. Femi, I believe your platform helps out with primary health care to a certain extent.
Very true, yes.
Okay, so could you expand on that?
Yeah, I think Dr. Ola has pretty much summarized the issues. In fact, there was actually an NHS study that shows about 70% of primary healthcare conditions can be treated without a face-to-face visit by a doctor. And that's one of the first pieces of research that we saw that allowed us to build the first iteration of what we're doing right now. And the interesting thing is because you're having this massive penetration of cell phones in like rural areas in pretty much every single person's pocket, you're able to build systems or platforms that allow people to connect with not necessarily just doctors, but even like pretty well-trained nurses or community healthcare workers that are able to sort of solve the very simple problems of malaria, cough and catarrh, and all those things. And very often, once you can sort of resolve those issues, it's a big positive impact on primary healthcare.
Okay, so going back to your platform, I'll come back to you later. Temi, right? Yes. You are involved with blood bank and blood services. Could you tell us how that works?
Right. So the data we have that we put together said 1 in 3 people entering a hospital will need blood on the continent. It's a lot in the US, and in the West, it's about 1 in 10. In our society, it's about 1 in 3 because first we have poor roads, so you have a lot more like motor traffic accidents, and also, of course, a little bit higher increase in gynecology, trauma, right? So a lot of people need blood, so about 1 in 3. And when they don't get blood on time, they would die. And it's just really that simple. We did the math for moms. It's about 26,000 women. Of the about 50,000 women dying in childbirth, it's 26,000 of them died because blood was not available at the hospital when she gave birth. So what we're trying to do, the problem we're trying to solve is make sure that we take that part of the workflow and make it efficient, make it better, make it seamless, and innovate around that using technology and smart logistics. So we work with hospital systems where with just a few clicks of the button, they can procure blood, procure anything that needs like an emergency delivery. And we're able to do this round the clock. We're able to do this in 55 minutes, 24/7, 7 days a week. So it's been really a game changer in the market.
So even with the, we had trouble getting blood now, today, because of the strike.
Sign up.
So you can get blood even though there's a strike and the people are not
Absolutely. So we have actually what happened because of the strike. People are like rushing to private hospitals. They're rushing to any hospital that's open. And we know those hospitals, so we can work with them and figure out what their demand is, because we know that demand will spike up. So we are also like doing some work around making sure that we have increased supply. We've been able to deliver every single pint of blood within this strike that we've gotten. So it's been really amazing. And my team, we had to work longer hours and make sure that we figure it out. But we've been able to solve that part of the problem in healthcare pretty significantly.
Okay. What I'm hearing is that data is a big part of all of this. Everybody talking today, everybody's platform has something to do with data. Okay. So let me start with Dr. Femi again. I checked out, first, where did you get the name, Kankpe?
Should thank former president for that. I did Kankpe. So
That's it.
yeah,
That's why, because I was looking at it, I said, could it really be Kankpe? But all right.
We just took poetic license with this.
I see. Okay. Now, you have doctors signed up. And then, how do the patients know about this? So you download an app on your phone.
That's correct.
And then you have fever or gonorrhea, and then you call up and you get advice. Now, the question I have is, suppose a wrong diagnosis is made without seeing the patient. How does that get sorted out?
That's actually a very good question. It's probably the most common question that we get. And the thing is, we took a lot of time to make sure, because the primary purpose was to provide as good health advice as we possibly could. And we took a lot of time to make sure that the systems were built to provide that. So what we do is, first of all, it starts from the type of doctors that you put on the platform. We make sure the doctors are vetted, they're properly trained. Every single one of them works in a hospital, so it's not people like me who don't work in hospitals anymore. So it's people who are pretty much up to date with what goes on. So that's where you start. Then after that, the questions that are asked are vetted by other doctors. So we have people who are already on the platform who are going through the answers that have been provided on an anonymous basis. So you don't see who is asking the question, but you see the doctor that's answering the question. And then we can sort of take it back and figure out those who are providing good questions. And we have a system to sort of kick off doctors who are not and sort of compensate doctors who are. So that's pretty much already factored in.
And if somebody is too sick to be treated on the phone, you have a mechanism to refer.
The interesting thing is that is essentially what pushed us to make the decision that we took to sort of expand our offering. So right now, it's not just the ability to speak to a doctor on a phone. Right now, we actually provide hospital care. So we've more or less morphed from this telemedicine company into a pure play health insurance company, where you pay us a fixed amount. Right now, it's minimum of 3,500 naira every month. And if you don't want to go to hospital for very simple conditions, you can speak to a doctor on your phone. When you do need to go to a hospital, you can go to a hospital nearby, pick up your treatment, and it's all covered in the cost.
So can I pitch in there? I think there is this thought that we need to fight against. Like the question that you asked him, how do you verify the doctors? How capable are they? And we have a lot of doctors. Totally we know the density of doctors, per capita density of doctors in our part of the world is much lower than various other parts of the world. And when we started registering hospitals, doctors, clinics on our portal, a lot of times this question came to us. And we told them we verify their details, we verify whether they actually exist, a physical verification check. And someone asked me, do you check their degree? And I said, no. And they said, you're not doing the right job by not checking their degree. And my question to them was, how many times has it happened that you have gone to a doctor and you have asked him, can you show me your degree? Has anyone gone to a doctor and checked that? Anyone? It doesn't really happen. It's actually a trust-based economy. We need to first ensure that we can actually find an eye specialist. If you don't know where the eye specialist exists, how are you going to choose which eye specialist should I go to? And imagine a scenario when you have a car accident and you have a severe injury in the car, and you are now going and checking where can I get a good eye doctor. So the stage we are at, we already understand that the medical practitioners are very less. Number of medical practitioners are very less as compared to the demand. So at this point in time, we have to take the support of technology to start somewhere and bring everyone who can contribute to make this ecosystem better one step above. So even today, all the doctors that are there on WeConnect are not vetted, are not verified in terms of their degree, which institute they did. But we still get a lot of people, a lot of gynecologist checkups, or a lot of people looking for a vet, various other medical practitioners coming on, requests for them coming on board. And we feel we've started somewhere and we can take it to the next level.
Okay, now, I've been told that a lot of the audience here are entrepreneurial and involved in startups and things like that. So I'd like to ask Dr. Ola about funding possibilities for these young entrepreneurs.
So I've been in business almost 10 years now. And as your company grows, you start actually having the problem of where do you put your residual income in Nigeria. So you can either give it to Uzoma and let him give you like 3 or 4% on the dollar, which isn't very good for business. Or you can go and put it in the Nigerian Stock Exchange and just, cross your fingers and hope that the share price is not going to go down, and then you can go and be agitating at the AGM at the end of the year to go and complain about dividends. Or you can put it in companies, you can put it in people, and that's what we decided to do. So over time, we've accumulated a few $1 million of residual income, and we decided to put a proportion of that. We are still doing the agitating at the AGM, whilst we are doing the fixed deposits and the long-term bonds, but we decided to put a proportion of it into startups to help them grow. So we started Green Tree Investment Company with a few of my friends, and we've invested in a whole spectrum of startups, from fintech to software to healthcare, and mostly it's a bit fintech heavy right now, but we're expanding into other spaces, and we're really enjoying the process of seeing these companies grow and thrive in the Nigerian economy. So I'll just quickly share 2 major lessons that I've learned in the process of growing my own company and investing in other people. So the first thing is, I think that every company needs to start from the point of view that they're a big conglomerate. So put the stuff in place that you would put literally if you were Apple or Facebook. Don't wait to put your financial records in place, because Nigeria is actually quite a low trust environment. So you find that people are actually willing to pay a huge premium if you just have stuff on paper. Corporate governance, if any big man you know, there are plenty of unemployed big men right now, they're retired, they're not doing anything, get them on your board, because they bring credibility. Professional, credible people are very important, and there are a lot of them. All these retired government people, there are many. Over 60, they're not doing much, they're just playing golf on a Saturday. Recruit them to your board, because immediately they bring credibility and they can tell you what to do and put you through. So that's the first thing I've learned. Then the second thing I've learned is about people actually liking money. This is, VC is a commercial thing. Investment is a commercial thing. And I think especially we're respected in healthcare because we're supposed to be, people assume that it's a social service and we're supposed to be doing it for free. I've never done anything for free. We have a corporate social responsibility program that does evacuations for free for people that can't afford it. But my business is my business. Since I was 15 years old, I've had Dangote on my wall because I want to create that level of impact, but also have that level of have that level of profits. So especially in the healthcare space, but also for all the potential tech startups and people that are thinking about starting up, you must remember your money. Where's your money coming from? How are you going to make money? What is your profit margin going to be? Does anybody need the product in the first place? So those are the 2 lessons that I've learned.
In terms of opportunities in the space, I meet up with a lot of people who love to do stuff like, I want to start an EMR, or I want to open like this really big, but the truth of the matter is, the big opportunities that exist in the healthcare space in Nigeria today are the simplest things. It's like, how do I get drugs from Alaba to so-and-so hospital? How do I make sure that, like, the simplest thing? So the advice that I would give would be, go and meet people who are in the healthcare space today and ask them what their biggest problems are. They will give you a laundry list, and pick the simplest ones. There's always somebody who's willing to pay to solve the simple problems.
And just to add to that, I completely agree with both of you. I think I said if I see another EMR startup, I'm gonna scream because they come up every day. There are lots of problems. There are a lot of highly neglected, entrenched problems in healthcare. Life Bank, you know, I always say I'm quite surprised it took me to start a Life Bank, right? Because the problem has been like around for so long. So there are lots and lots of problems like that in the healthcare sector where just organizing and like bringing transparency is the most innovative thing you can do. So you have to sort of like, before we think high-tech, like VR and things like that, like virtual reality, we have to think about how do you like create structures to move blood at 3 a.m. in the morning to a hospital where a mom is bleeding. It's really that simple, a lot of the problems like that. And finding elegant solutions that have a business model is like the next step. So once you discover the problem that is highly entrenched, then you have to figure out the business model. Our own business model was very simple. We charge a delivery fee to hospitals, and once we realized that they're the ones getting the most value from what we offer, we just knew that that was where to put the business model in. That's what we should charge, and it's been really incredible. And of course, you have to also understand that for the most part, healthcare is also like a low value business, but with a lot of volume, you make enough value. So you have to build your business model in to that specification. But I think there are lots of problems. There are problems around payments. I think Campe is already working on that. There are problems around, monitoring and evaluating services. There are lots and lots of problems in primary care that you can fix. Even just identifying people that are entering the healthcare system is a huge opportunity that I think someone could take and solve.
Yeah. Are we running? Okay. So the point here is about investment. It's a simple strategy of finding out at what stage your company is. Are you at the trust stage or are you at the scale stage? If you are at the trust stage, go to someone who trusts you and the concept that you are building. And if you're at the scale stage where you have proven the trust module, there are a lot of people who have the money, who are actually looking for the right returns and would look forward to invest in your company. But you have to find, in this early stage, it's very difficult because there are less people who trust you and have the money to give to you. In the later stage, if you have got the right numbers, there will be people who are in the scale stage who have a lot of money to invest and will provide to you.
I have a question before we throw it out to the audience. Everybody talks about telemedicine. Now, question I have is how realistic is telemedicine in this environment we are in with our spotty network issues? Because, whether you're using your cell phone, your wireless internet connection, it's hardly ever stable. And so I'm wondering, how do we go about telemedicine with that network? I don't know if any of you has...
Yeah, I guess that's for me. That's a really good question. And the fact is, when we're building our telemedicine component, we sort of started from that assumption that, the network is going to go down, or, your internet is going to be unavailable. So essentially, it's really building around the infrastructure that exists. So even if you look at a lot of the technology that's been built for Nigeria or pretty much every other African country right now, say BRIC, for example, right? They're building with the assumption that the network will go down. So if you're building your technology with those kind of assumptions, you can build around. So I'll give us as an example. So the way our system works is that you can have the conversation via the app. You can also have it via SMS. SMS is a lot more stable than, internet. So if one fails, the other one will. If you want to continue to have the conversation via the app, we already have systems to sort of cache or sort of hold in place that message. And when the system is back up, it gets sent and then you can get replies. It's also about understanding the limitations of the system. So a lot of the telemedicine initiatives that had come up before we sort of, and a few others had sort of come into the space, were basically focused on video. So it's like, oh, how do I have this video conversation with this doctor in Ibadan, and I am in, like some village somewhere in Ekiti, for example, right? But the thing is that our systems, you said, the systems can't support that. But you do find that most of the conversations that are happening on those platforms could have been done via text, or could have been done via like voice notes sent back and forth. So I think the summary is, it's basically about building around the infrastructural limitations that we have, and if you do, you will be able to get workable solutions that solve the problems that exist.
All right, I think we are ready for questions from the audience. Am I taking the questions or?
Okay, good morning, everyone. My name is Alex Chude. Quite informative and enlightening, all that have been said here today. One of what you highlighted when you started is the problems that are prevalent in the healthcare sector. One of them is training. Now, I am building a business, or I'm working on virtual reality, Recruit Nigeria, which is a training and recruitment center using virtual reality technology. Now, do you think, I just want to ask your opinion, because she said we can identify the little problem before going into virtual reality. I'm working on building my prototype right now. So do you think virtual reality can come into play in solving the problem of training? It's expensive to train surgeons and other medical practitioners abroad and all that, but with virtual reality, you can immerse them into a simulated environment, train them, and that just solves that. I don't know if you share the same idea, sir.
Actually, yes. In that, I mentioned that virtual reality is high tech, and you might want to solve low tech first. But for the problem you've stated, if the technology fits, then of course it makes sense. Like you mentioned, training surgeons, and if you can build a system where you can actually follow the path inside their body, and then you actually can train them, then it makes sense. So I just want to sort of correct that assumption.
I have a bit of a different opinion. I'm sorry. So if you want to take it down to the fundamental problem, right? The fundamental problem of healthcare manpower in Nigeria is twofold. We're essentially pouring water inside a leaky bucket. And the bucket is small. So we're pouring water inside like a really small leaky bucket. So one, we're not training enough doctors. Two, the few doctors that we are training are leaving the country. The solution to that problem, are twofold. One, increase the number of doctors that we train and try and stem that leaky bucket, or try and get a way to use those doctors who are abroad to help us here. Not to knock your idea, it's a great idea. I think it can work. But if you look at the fundamental problem on hand, is virtual reality going to help us train more doctors? Not necessarily. You need to build more medical schools. You need to get more people into medical programs. Is virtual reality going to help solve the issue of doctors leaving Nigeria? Not necessarily, right? You need to improve the kind of access and perks and compensation and benefits that they have to make it more beneficial for them to stay. Is it going to improve the fact that doctors are abroad and they could be in country? Probably, yes. But it still boils down to the fact that what's the simplest solution for this problem? And it probably might not be virtual reality. It could be more policy-based or something.
I actually have a different opinion. So an entrepreneur is somebody that solves problems at a profit. If you are not making profit, then you're a charitable organization. Now, if you can convince anybody in Nigeria to buy it and you're making profit, then you have a business. If you can convince anybody in Kenya to buy it and you have a profit, then you have a business. If you can convince somebody in Australia to buy it and be bringing Forex to Diamond Bank and the contract is $10 million, you have a profit. So I think that first of all, you need to look at your product and say, who can I sell this product to? Anyway, anyhow, if you are bringing Forex in, if you sell it to a foreigner, you're helping Nigeria because we're always looking for Forex. And if you sell it within Nigeria, good, you have a business. So you just need to see who can buy it, who's your customer, who can you sell this thing to. Try and sell it to the Chinese, try and sell it to anybody. In any way, you're solving a problem.
Okay, I have another opinion. This virtual reality thing, if you look at the whole structure of medicine, many people think you're trying to train surgeons how to do robotic surgery and things. No. We have more fundamental problems. Nursing training, technical training, that can all be done with your concept. I wouldn't start at the surgeons. I'd start with where we really need help. Because the high-tech, the highly skilled surgeons are around. They're actually here. There are many people who have come back from the diaspora who are willing to work and things. So you don't need it there yet because we don't have the facilities for them to work in. All right, we have many surgeons who want to come, but we don't have the equipment. We don't have anywhere for them to work. So you're not going to be able to fix that problem immediately. But you can fix the problem with nursing, with technical staff, biomedical engineers, those kind of things. People forget the backbone of a hospital is not the surgeons, it's not the doctors, it's the nurses. And that is where your virtual reality will really come into play.
You've just given me an idea, actually. ACLS and ATLS, we have to travel for those courses. And all those standardized courses that they do, life support, you have to be there. If there can be a virtual reality solution where I don't have to travel for my ACLS or ATLS, or where people don't have to travel anymore and you can sell it to those people, then they do like 60,000, 40,000 courses a year. So if there can be a VR hack for any of those courses that are so boring and are so inconvenient and are so expensive, then you can sell it to doctors around the world. Remember, it's profit that makes the business.
All right. Back there.
Okay.
Oh, sorry. Okay.
Yeah. Times. All right, I just have a comment, especially for the V-Connect CEO. I'm a doctor myself. My name is Dr. Ogona, and we're here for this. So you made a comment about not being able to verify doctors that you put on your platform. I think you should. I think that because when a patient walks into the hospital, they don't ask the doctor for their credentials because they feel that the hospital has already done that. And the hospital will be held liable if that doctor is not qualified to be a doctor. So we're looking at V-Connect now. So if you don't verify, the question would be, can I sue V-Connect if I get a service from a V-Connect registered doctor that isn't really a doctor? Yeah. So
the verification part, sorry, go ahead.
I just wanted to throw it all out and then sit down and wait.
No
Okay, the second would be to the CEO of Flying Doctors. Thank you for being here. My question would be, you're very passionate about primary health care. How does Flying Doctors, because of the concept of, each time I hear Flying Doctors, I think of how much, who can pay, So I'm thinking of a woman in faraway Borno that needs to be evacuated. How does your passion for primary health care fit into the solutions that your business is providing? And lastly, just to say big ups to Life Bank. We've worked with them before and they did deliver. They've done a great job. So thank you very much.
Okay, first of all, I'm passionate about business. And then I'm passionate about healthcare as well. But I run a business. So I love to do CSR projects. I'm from Ekiti State. I love to do all those CSR projects there. I make a profit, so I can do anything that I like with that profit. I can decide to open up primary healthcare centers there and do that. That is CSR. But I'm a businesswoman, a consummate capitalist. And if the federal government at any point in time says, Ola, look, we want to start doing air ambulance services in Nigeria and we want to transfer people to central centers so we actually have enough money to concentrate on primary care. Yes, sir, this is my bill. But I'll not do anything that does not fit into my bottom line. So I'm very, very passionate about those things and I do charity for them. Yes? Okay.
On this side, Madam, sorry, I didn't catch your name. Okay. Ugono. So, we verify the businesses, that the existence of the business is there. Physical address is there. Clinic exists. But what we are not able to verify very clearly is whether the doctor has got the right degree from the right institute and he has the skill set to serve. the idea is to be able to provide the visibility to enough medical practitioners so the users can make their decision. Thanks.
Good afternoon. I have a series of questions for Mr. Rustagi. So, I would like to know if it's possible for me to just see you after the talk, if I would be able to access you. Okay, so I'll ask all my questions then because it will take a lot of time. Thank you.
Thanks.
We actually need to wrap this up shortly, so please, can you direct the next, maybe the last question, please?
Okay.
To some
Side there, yes.
equality. Let's move to this side.
Thank you. My name is Damola Oladipo. Well, through the telemedicine, I'm trying to see if I stay in Lagos now, I get to see a doctor, then I move to Benin, then the doctor wants to see my medical history. So how do you go about that? Is it a system on ground trying to check me that particular problem? Thank you.
So I worked, before I relocated, I worked in the NHS, and we were trying to, at that point in time, the government was trying to do, I'm sure you're familiar with the project, the medical spine. And that was supposed to be a project where if anybody moves, like I grew up in a very small town in England, I grew up in Lowestoft, as in it's like one of the most remote agricultural and fishing communities. But I was moving around for university, so they were trying to do a spine to make sure that people like me that were mobile around the whole country could access their medical records at any place in the country. I think that they put at least 4 times of Nigeria's healthcare budget into the project, and the project did not take off. So what I would advise you, especially, is to have some copies of your medical reports, store them on a secure Google Drive and whatever, so that if you're ever in need of, and let your relatives know that it's on your Google Drive. And that's what I tell most people, because we also deal with expats. And 1 minute they're in Kenya, the next minute they're in China, the next minute they're in Australia. And that's the new way of work. We're part of a global workforce now, where you can work at any place at any time. So it's a good idea. Even if we succeed in building a Nigerian national spine, we're citizens of the world and we travel around, it's a good idea to have your existing conditions with you on your person. Some people, even with specific conditions, have it on a wristband, so that any doctor, wherever you find yourself, can identify that this is the condition that you have, and this is at least a summary of your medical records. And that's the situation for now. But I don't know if there's any startups working on the problem.
I'm not aware of any startups working on the problem of transferring medical records from one place to another, because I think you sort of need to start from establishing or digitizing the medical records from scratch. That's the fundamental problem. So I think on a personal, if it's for you personally, I think Dr. Ola has pretty much answered the question. Make copies, store it on a flash drive, you can send it. On the Kanpe platform, essentially what we do is all the conversations are pretty much stored, and any doctor that needs to access the previous conversations has the ability to do that. So that's already sort of pre-programmed into our telemedicine platform.
Yeah, and transferring patient records anywhere in the world is always a problem because of privacy issues. So you're best keeping your own records and taking them around with you, rather than leaving it out. Once it's in the cloud somewhere, somebody you don't want might be able to access it. I think we have time for no more questions. All right. Okay, ladies and gentlemen, so I think we're done. And I hope you all enjoyed the session. And I want to inform you, healthcare is moving rapidly in the right direction. Now, as I speak here, there is open heart surgery going on in 3 hospitals. All right, right now. So many of you don't even think open heart surgery exists in Nigeria. But it's going on in Ikoyi, it's going on in Lasut, and it's going on in Babcock right now. 3 places doing open heart surgery right now, today, this minute. So please, healthcare is not as bad as you think. It's a lot better. So next time I'll ask you to vote and we'll see. Thank you.